Thank you very much, Barry, for that introduction. Good afternoon to everybody here. I'm an everyday practitioner. I've been in practice since 1986, and I'm very excited to see some of the things I've seen taking place over the last year or so. And again, I want to welcome you as members of the media on behalf of the American Optometric Association and also our good friends at the 3D at Home Consortium. During my tenure as the AOA president over the last several months, I've had the opportunity to see many exciting things happen in our profession. Last year, when several 3D movies opened across the country, they thrilled moviegoers with our dynamic special effects and graphics and enhancing their experiences at the theaters. For some, though, this experience was a disappointment because a potentially undiagnosed vision condition interfered with the ability to see 3D images. And now, 3D is moving quickly into the home with televisions, home health gaming devices, and even more, as you've heard this afternoon. This has presented my profession, optometry, a wonderful opportunity as America's family eye doctors that we can educate the public about talking to their optometrists during their exams about problems they experience during viewing 3D images. We're pleased to partner with our friends at 3D at Home Consortium on this important public health issue. It's estimated that anywhere between 3 to 9 million people have problems with binocular vision, prohibiting them from watching 3D technology. It's our goal with this partnership between the AOA and the consortium will hopefully help and improve the understanding of 3D viewing as a safe and appropriate technology for all viewing audiences. By joining together, we intend to share data and promptly and promote vision health utilizing stereoscopic 3D displays. It's our hope that this cooperative relationship will be a conduit for exchange of the most current information and research and help increase the use of 3D technology as we work to develop these strategies and exchange ideas and share best practices. And some of you may or may not know out there, the AOA has been very involved in public health issues in the past. Again, this MOU we're going to talk about now is talking about a current public health issue, but let you know that the AOA was involved with a program called Infant C back in the year 2005, where we identified a public health issue out there about the importance of exams at an earlier age, and I heard that mentioned here in the lectures today. Again, this Infant C program is a program that from age 6 months to a year that optometrists across the country will provide a visual health assessment at no charge to the American public out there. Another thing you may not know about public health out there is during the healthcare reform debate, the American Optometric Association was a champion for the children of this country. As part of the healthcare reform in the year 2014, when the state exchanges start, we now have an essential benefit for children's vision from birth to age 21 that will be a part of the newly created state exchanges in the year 2014. It was our goal to make sure that we talked about the public health issue about having children having their eyes examined at an earlier age. And again, you heard many lectures today that discussed that. Another thing we're working for in healthcare reform now is the fact that it's important for all Americans, not just our youngest Americans, to have a comprehensive eye examination. We're currently working with a healthcare reform. We're working with insurers across this country to make sure that a comprehensive eye exam is a part of the healthcare plans across this country. The American Optometric Association does, in fact, represent about 36,000 doctors of optometry, faculty and staff, if you've seen here today at this university here, also para-optometric staff, and also optometry students that you've seen here today. Something you may not know, that optometrists currently practice in about 6,500 communities across the country, and in about 3,500 of those communities, they are in fact the only eye doctors in the area. So in fact, your doctors of optometry provide about 2/3 of the primary eye care needs in the United States. And to be honest with you, we're positioning now the American Optometric Association to handle the upcoming need for primary eye care across this country with the aging baby boomer population in Medicare, the expansion of Medicaid, and also the uninsured population that will be coming into the healthcare system with healthcare reform. So again, we're looking very forward to this partnership here, and also helping people experience the 3D experience to the best of their ability. Thank you very much.
And now to present perspective from the 3D at Home Consortium, Rick Dean, who's chairman of that organization. Rick.